Now that we've talked about assessing pain, let's shift our focus to one of the nurse's most important responsibilities, safe pain medication administration. One of the biggest misconceptions about pain medications is that they're simply given based on a pain score. In reality, selecting and administering pain medication requires clinical judgment, careful assessment, and ongoing evaluation. As nurses, we don't simply ask, "What number is your pain?" We ask, "What is the safest and most effective way to manage this patient's pain?" So let's begin with one of the most important concepts, the goal of pain management. Okay, it's not always zero pain. Instead, our goal is to help patients reach a level of comfort that allows them to function safely while minimizing medication side effects. For one patient, that might mean being comfortable enough to walk with physical therapy. For another, it might mean sleeping through the night or taking deep breaths after surgery. Every patient's goal will be different, so pain management should always be individualized. Before we continue, I want to point out one thing about this graphic. It is designed as a quick reference study guide, so you'll notice that it includes several examples of pain medications. For this course, I only expect you to know the medications listed on your ticket to enter for this class. The additional medications are included to help you begin recognizing medication classes and to show you how these drugs relate to one another. As you progress through the nursing program, you'll build on this knowledge, but for now, keep your primary focus on the medications identified in your ticket to enter. So let's talk about choosing the right medication. Pain medications are selected based on the patient's assessment, the type of pain, and the severity of the pain. For mild pain, non-opioid medications such as acetaminophen or an NSAID may be appropriate. Acetaminophen is commonly used to treat pain and fever. One of the biggest nursing considerations is to monitor the total daily dose. Many combination medications already contain acetaminophen, so always check the medication label to prevent accidental overdose. Patients should also be instructed to avoid alcohol while taking acetaminophen because both can increase the risk of liver toxicity. NSAIDs, things like ibuprofen, naproxen, ketorolac, are especially helpful when pain is related to inflammation. However, they are not without risk. You still need to monitor for things like gastrointestinal irritation or bleeding, kidney impairment, and fluid retention. And remember that many NSAIDs should be taken with food to help reduce stomach irritation. Now we'll discuss more about NSAIDs when we discuss the concept of inflammation. When pain becomes more severe, opioids may be necessary. These medications are highly effective, but they also require increased nursing assessment and monitoring because they affect multiple body systems. One of the most important messages I want you to remember is this: pain relief and patient safety always go together. Before administering any opioid, pause and perform a complete assessment. Ask yourself, has the patient's pain been thoroughly assessed? What is the patient's respiratory rate? What is their level of consciousness? Are they becoming overly sedated? Are their vital signs stable? Never focus only on the pain score. After giving an opioid, continue monitoring both the patient's pain relief and any potential side effects. Now, some common side effects include things like constipation, nausea, vomiting, drowsiness, itching, urinary retention, and dizziness. The most serious complication is respiratory depression. Remember the classic warning signs of opioid overdose, which include slow or shallow respirations, increased sedation, or difficulty awakening the patient. Also, pinpoint pupils. If these signs occur, notify the provider immediately and be prepared to administer naloxone, the opioid reversal medication, if indicated. Let's talk about some special medication considerations. So some medications, pain medications, require additional nursing considerations. For example, fentanyl patches should never be cut. and the old patch must always be removed before applying a new one. Because fentanyl is absorbed slowly through the skin, pain relief is not immediate, so it should never be used for sudden or for breakthrough pain. Another concept you'll encounter is stacked PRN orders. Sometimes a provider writes 2 different doses of the same medication depending on the patient's pain level. So for example, a patient may have an order for acetaminophen 650 milligrams for mild pain, or they might have an order as well that includes 1,000 milligrams for moderate pain. These are either or orders. You select the appropriate dose based on your assessment. Never do you administer both doses together. This is another reminder that nursing assessment always comes before medication administration. Now let's also talk a little bit about multimodal pain management. One of the biggest ways, or best ways I should say, to manage pain is through multimodal analgesia. So rather than relying on one medication alone, we can combine multiple pain management strategies. So this may include medications together with repositioning, ice, heat, relaxation techniques, guided breathing, massage, distraction, or music. Using several approaches often provides better pain relief while reducing the amount of opioid medication needed. That means fewer side effects and safer care for the patient. Remember, medications are only one part of effective pain management. Okay, so I do want you to know the difference. Students often confuse 3 important terms, so let's quickly review these terms. So tolerance. Tolerance means that over time, the patient requires a higher dose of medication to achieve the same therapeutic effect. When we talk about physical dependence, this means that the body has adapted to the medication, so withdrawal symptoms may occur if it's stopped abruptly. Now, addiction is different. It's a chronic disease characterized by loss of control, compulsive use, discontinued use despite harm, and craving. Understanding these differences helps reduce stigma and supports compassionate, evidence-based care. Before administering any pain medication, remember this simple sequence. Assess. Perform a complete pain assessment and determine whether medication is appropriate. Then we'll administer. We'll select the appropriate medication, make sure that we have the right dose, administer by the right route, while following safe medication administration practices. We also need to monitor, so we need to observe the patient for pain relief, any adverse effects, and any signs of complications. And then lastly, don't forget to evaluate. Determine whether the medication helped the patient achieve the desired level of comfort and function, and decide whether additional interventions are needed. Remember, great nurses don't simply give pain medication. They think critically before every dose. So know your medications, keep your patients safe, because your nursing mindset makes the difference.